feel free to ask questions throughout the presentation. It's formal but informal. So I'll just get started. So uterine fibroids. What are fibroids? Fibroids are benign growths of the muscle of the uterus. And there's different types of fibroids. They can grow on the inside of the uterus, the outside of the uterus, within the uterus. And depending on what type of fibroids you have determines what type of symptoms you may have as well from it. Who's more likely to have fibroids? Usually women in their 30s to their 40s, but you can develop it at any point in your life, all right? Typically during this age range is when women tend to complain about the symptoms of a fibroid though. They occur more commonly in African American women, but are definitely seen in Caucasian women and women of other races. They typically seem to occur and grow at a younger age and grow more quickly in African American women. As you approach menopause, it tends to slow down the growth, obviously because of the hormone production, or the lack of hormone production. The impact that fibroids have on women, as you can see again, showing the age range, African American women being in the red and Caucasian women being in the pink. You have more African American women in each age category that have fibroids. When we're talking about the symptoms of fibroids, I said, sometimes it just depends on what kind of fibroids you have. Well, most commonly we see changes in menstruation. Women typically complain of longer, heavier menstrual cycles that causes lots of cramps. They tend to have vaginal bleeding at other times than their menstrual cycle, so in between menstrual cycles, and tend to develop anemia. Anemia is when your hemoglobin or your blood count is considered low. You can experience pain. It may be pain in your back, pain in your abdomen, crampy, sharp, just various types of pain, and also pain during sex, and that would depend on the location of the fibroid as well. Some women feel pressure that may cause difficulty having bowel movements or urinating, again, depending on the location and how large the fibroids are. Oh, and then back to the last one. When it comes to fertility, some women experience miscarriages or infertility due to fibroids that are against the lining of the uterus. And then sometimes fibroids cause no symptoms at all. Sometimes we find them incidentally on an ultrasound, doing an ultrasound for another reason, and women are found to have fibroids. All right. And here's a graphic representation of the symptoms of fibroids and how common which ones are. And as you can see, the heavy menstrual cycles are typically what women complain about when it comes to fibroids. And these are fibroids that are known or found. The incidental ones, the ones that they don't know they have no symptoms. But most often it's heavy menstrual cycle. The type of complications that can occur, fibroids can outgrow their blood supply, so they can cause severe pain, severe cramping, sharp pain in the abdomen because they're outgrowing their blood supply, and so the cells are dying that are not getting blood, which will cause the pain. It can also twist upon itself. The fibroids that are on the outside of the uterus may twist upon a pedicle that it's connected to the uterus by, and that can also cause pain. You can have increased abdominal swelling, all right? So if you notice, years ago, you had a flatter tummy, and then years later your tummy's larger. You're like, why? I know I gained a few pounds, but why is it that big? Sometimes it's fibroids. Cancer, rare, but cancer can occur. Typically we suspect that maybe there's a cancer there or cancerous growth there if the fibroid grows very rapidly, or the uterine mass, I should say, grows very rapidly.
How could you tell if it was cancer? Would you bleed differently or something?
Well, the only way we would really know is if it was depending on the location of the fibroid, if it was against the lining of the uterus, then we'd do a biopsy of the lining of the uterus or remove the fibroid. Yeah, that's really the only sure way is having a diagnosis, some tissue to say, yep, this is cancer.
Okay. Thank you.
No problem. And then, as I talked about before, infertility can be a complication of fibroids. The way we diagnose fibroids, first and simple, is our pelvic exam. So when you're coming in for your annual exam, everybody gets a pelvic exam done. It's to assess the size of the uterus, if there are any masses on your uterus, and it's to also assess your ovaries as well. So the pelvic exam is one. We also use ultrasound, which will show us certain characteristic of the uterine mass. And based on that characteristic or how it looks on ultrasound determines if it is likely a fibroid. Now, there's no 100% guarantee even with an ultrasound. I've seen cases where they thought it was a fibroid and then you get it out and it's not a fibroid. It's another type of mass or cancer. But most of the time, this is pretty accurate. Another thing we use is hysteroscopy. So hysteroscopy, basically we put a camera inside of the uterus and we take a look inside of the uterus, all right? That's called a hysteroscope. And here's a picture of looking in the inside of the uterus and you can see this mass sitting in there. Those masses are the ones that tend to bleed and cause the heavy menstrual cycle or the irregular menstrual bleeding. We also use hysterosalpingogram, which is when we put a solution inside, normal saline inside of the uterus, and we take a picture of it, all right? Not normal saline, we use a dye, sorry. We use a dye inside of the uterus and we take a picture, x-ray picture of it. And it can outline or show us if there's a uterine mass inside. We also use sonohistograms, which is putting saline inside of the uterus, and using the ultrasound to determine if there's a fibroid on the lining of the uterus. Laparoscopy, this helps us diagnose if there's fibroids coming from the outside of the uterus. So we put a camera inside of your abdomen, and this is obviously you're asleep. This is done in the OR. We put a camera inside the abdomen, and then we can actually see from that view if there are fibroids. And these are the fibroids that are here on the outside of her uterus. These are the ones that will likely twist off and cause necrosis or cause that sharp pelvic pain if you have those type of fibroids. They twist on the pedicle. So there's other imaging tests that can be used, MRI, especially if we are preparing for a fibroid procedure that we want to be able to map out where those fibroids are located and how to go about taking the fibroids out, how to go about attacking those fibroids. All right, and we also use them to track the growth of the fibroid over time. So when is treatment necessary? Lots of cases we don't need treatment at all because those are the cases where the fibroids don't really cause symptoms in those patients. But if a person comes with abnormal bleeding and we suspect that it's due to a fibroid, then we may recommend treatment at that time. All right. The heavy and painful menstrual cycles, especially when they cause you to bleed so much that your hemoglobin drops, causing anemia. It's definitely a reason to remove fibroids. Bleeding between menstrual cycles. So any of the symptoms that I named could be reasons, especially if it's affecting your quality of life. There are certain medications that we can use to help treat the fibroids or help treat the bleeding related to the fibroid. And they're usually hormones in the form of birth control pills, Lupron, certain categories of medication, but pretty much hormones that will help control the bleeding associated with fibroids. And this is our Lupron. It's called a gonadotropin releasing hormone. But basically, they stop the menstrual cycles and shrink the fibroids. We use these when we're preparing for surgery to help shrink the fibroids, to stop the bleeding so that you're not anemic going into the surgery. But usually once you stop it, the fibroids do tend to grow back. So this is kind of a temporary type of drug that's used for about 6 months.
Can you use that even though you're not bleeding anymore? if you're in menopause? Or
No, we wouldn't use that typically. Typically, it's used if you are anemic because of the fibroids. Yep, and it shrinks them. Because again, you're only going to stay on it for a little while,
Right.
just for surgery purposes. The IUD is one that we can put inside of your uterus to help control the bleeding associated with fibroid, as well as just heavy menstrual periods in general. So other treatment options include hysteroscopy, where we go in with that camera inside of your uterus, the picture I showed before. Go inside with the camera inside of your uterus and actually remove the fibroids that are lining the uterus. This doesn't work for fibroids that are within the uterus on the outside of the uterus, but only for the ones that line the cavity of the uterus. We sometimes do endometrial ablation, which is burning the lining of the uterus, depending on the size of the fibroid though, so there's certain qualification. Oh yeah, yeah, this is in the OR. This is in the OR. A uterine artery embolization, basically that's putting a product into the blood vessels to cut off the blood supply. The most common side effect being pain with that. If you cut off a blood supply to anything, it's going to cause pain because those cells are going to die. So that would be the more painful, I would say, of the treatment options. And then we have other surgeries that we do. Everybody's probably heard of a myomectomy, where we go in and pretty much scoop out the fibroids themselves, leaving the uterus intact. Especially if you want to maintain your fertility, this is a way to do that. They do regrow though. Fibroids are benign. They can grow anywhere out of any uterine muscle. So they may grow back, but this gives a woman time to have a baby. Okay. Hysterectomy, everybody's heard of hysterectomies, where we remove the entire uterus, all right? Obviously, a fibroid won't grow back if we do this. So this is the end-all, be-all if you don't want anything inside of you. But it's not the only surgery that works for it, all right? And last but not least is our Acessa procedure. This is a new procedure that is a minimally invasive treatment for fibroids. It's done in the OR as well. You're asleep, and it allows you to keep your uterus. Basically, it's using radio frequency to ablate the fibroids or burn the fibroids. And I've got lots of examples coming up for you. All right. So it treats only the fibroids without destroying your regular uterine muscle. The patients typically go home the same day. We may observe them overnight, but typically go home the same day. And then they tend to have rapid recovery to normal activity. This is all done minimally invasive, again. Very low complication and reintervention rates.
So on the rapid recovery, you're talking maybe a couple of days?
Yeah, less than like a week. I mean, it's done, it's a laparoscopic procedure, so typically about a week. We say take a week off work.
Okay.
Mm-hmm.
Do they, when you say you burn them, do they grow back or they just?
Well, a fibroid can grow in any other part of the uterus. It's not going to grow in that particular part because that tissue is ablated. Yeah, that tissue is pretty much gone. It scars down once you ablate it. But fibroids can regrow in other parts of the uterus though.
So this procedure is just mostly strictly inside the uterus or inside the uterus?
It is. It's within the uterus. I'm gonna show you the exact procedure. So take a listen to Tina's story.
I'm 50 years old and I've been in construction probably for about the last 15 years, and I have 4 beautiful children, and I'm from Northern California. Back in 2007, I had relocated to Florida for a job, and it was going to be a year out there. And so of course I didn't have any doctors or anything out there like that, but I was having issues with bleeding, and it became very severe while I was out there, to the point on a scale of 1 to 10 it was probably 14. I saw a gynecologist in where I live, and I had went to him and told him of my problem that I was having, and he suggested that I have a hysterectomy, and this was not an option for me. I also had a doctor in Florida that had suggested I have a hysterectomy since my childbearing days were over. I heard a commercial on the radio one day that basically saved my sanity, and I called the number, and I was doing a study for fibroids, and I knew I had fibroids. They had taken x-rays and stuff, so I knew they were fibroids causing these problems for me, and that's how it all began.
Shortly. So the Acessa procedure is what Tina heard about on the radio. So using the laparoscope, and we also use an ultrasound to help us map out the fibroids, all doing this with just 2 tiny incisions on the abdomen, all right? So under both the laparoscopic guidance and the ultrasound, the handpiece, as you see in number 2, the handpiece is inserted right into the fibroid, and then sprays out these electrode arrays, and those electrodes are the ones that actually burn the fibroid and treat it until we burn it until it's completely treated, the whole entire fibroid, all right? And the electrode array is then retracted, and as you see, the burning or the scarring of that fibroid is what occurs. And then the fibroid or the dead tissue eventually is reabsorbed by the body over time.
I was wondering what happens to all the little pieces, you know, where they went or whatever, but you take that, so now I know.
Yep. So Tina's going to tell us her experience after Acessa.
I went in, and everyone talked to me. You know, the doctors talked to me, the study people talked to me. Everybody was there and explained to me what was going to happen, and I went in, I came out, and I felt everything was great. I had C-sections in the past, so I knew, you know, I wasn't going to be cut open or anything like that. I went in, I was very relaxed. Basically what they said, I went to sleep, I woke up, I walked out on my own. I stood home for probably 2 days, only just to rest up, maybe take a little advantage of the R&R. And it was great. It was great. The bleeding stopped almost immediately. It was great. I literally bled for 2.5 years. I don't know how I can express that to you without, it was horrible. It was a horrible, horrible time. And it limited me to doing almost nothing. Even going to the grocery store, I couldn't even do that because of the bleeding. It was bad. But everything after that day, it just changed my life. It did. I don't bleed anymore. And I would recommend it to anybody. I got my life back.
This is the same exact testimonies that I hear from my patients who I've done the Acessa procedure on. It just changes their life. You know, they can't believe they don't have the bleeding that they had before. And all with 2 small incisions and, you know, this procedure done for them. So it is life-changing. It has changed a number of lives out there, so. For our patients who have had this procedure done, they get a significant reduction in the symptom severity. Like she said, almost immediately. By the time I see them in 1 to 2 weeks, they're already, you know, bragging and saying how much energy they have. So whether it's because they're not bleeding as heavy and not as anemic, or just the fatigue of, you know, just being tired and depressed about bleeding, they really do recover very fast and are very satisfied. At about 6 months, well, really at about the 3 month to 6 month mark, it starts to taper off as far as the I should say, like the transformation or the change from, you know, being at a scale of 1 to 10 being a 10, and how their symptoms are as to a 0, you know, 0, 1, 2. that starts to taper off at about 6 months where they're satisfied. And as you can see at the highest part of the scale, 79.3%, being where they top off or cap off even at 2 years. And the symptom severity is down here. So this is quality of life being better. This is symptom severity drop down considerably. So overall, the treatment effectiveness, 98% of patients say that they would recommend this procedure to a friend, okay? Most patients who, they're treated as an outpatient basis, meaning that they go home the same day. They experience an increase in the health state or their quality of life. 73% said yes. Express treatment satisfaction. Almost everybody is satisfied with their treatment, okay? And then again, almost everybody feeling like the treatment was effective in eliminating their symptoms. So great satisfaction rate when it comes to Acessa.